So you've lost the weight, but your arms continue to have excess skin that remains no matter how much you exercise and tone. My name is Dr. Eric Barker, and I'm the plastic surgeon here at Peak Plastic Surgery Center who customizes in breast and body cosmetic surgery. When talking about an arm lift or brachioplasty surgery, it is very important to understand what does it correct and who is the optimal candidate for it. So when we talk about a brachioplasty or arm lift, what we're aiming to do is to remove the excess damaged skin of the upper arm to obtain a slimmer silhouette of the arm without that excess hanging skin. The appropriate candidate is somebody who's in good overall health. They are done with their weight loss journey, should they have had it, are also in a good position to recover from the surgery itself. Can exercise tighten up loose arm skin? What are the misconceptions with it, and when do you need to undergo a brachioplasty surgery? These are so important to understand prior to deciding to have a brachioplasty or arm lift surgery. If the arm skin that has excess on a patient is minimal and the skin has elastic qualities, you can hope to obtain a tighter, more defined contour of the arm with exercise alone. However, if the skin is damaged, aged, the elastic recoil properties are not what it used to be, and you have significant excess, diet, exercise, toning alone may not do it, and you may need an arm lift to obtain the results you're hoping to achieve. So when understanding where the scar is going to be on a brachioplasty surgery, you need to discuss this with your surgeon prior. The position I like to put my scars is on the inside of the arm, but I do have what's more called a hanging technique. I don't like it right between the bicep and the tricep. These scars typically end up healing thick, darker, and a lot more unsightly. When I put mine a little bit more inferior, more on the tricep, it heals a little thinner, lot lighter, and a much more sightly scar. It also is hidden so that if you have your arms at your side, you do not see it from the back. So understanding the scar position, how it should look, you need to discuss this with your surgeon during the consultation process. So many patients ask, does an arm lift usually combine with other weight loss procedures? The answer to that is individual. When my patients come into my clinic, I want to know what their goals are. I never try to talk patients into more surgery than they need. So if a patient comes in only concerned about their arms, that is the only procedure you need. However, if you have multiple areas of concern, it can be combined with other surgeries. So patients often ask, can liposuction be done at the same time as an arm lift? The answer to this is yes. With the technique that I use, which is a lymphatic and vein sparing technique with my brachioplasties, I incorporate a component of liposuction on every single case. However, different patients need different aspects of liposuction for contouring and or just to ensure that the amount of fat under the area of skin removal is removed. So I will go over this with each individual patient so that they can know the expectation and the extent of liposuction that will be used during an arm lift surgery. Recovery after an arm lift surgery is different for each patient, but overall is about 6 weeks. So for the first 2 weeks, you can expect to have a lot of swelling. You'll be wearing your compression garment around the clock, and you will have restrictions in terms of weightlifting and position. Over the next 4 weeks, I will work with you to decrease the amount of time that you'll need to have your compression garment in place, the amount of activity levels that can be increased, so that we slowly get you back up to your baseline levels, so that by about 7 to 8 weeks, you're back to full activity with no restrictions. Expectations of how long results will last after an arm lift surgery is really individualized to each patient. But overall, you can expect these results to be long-lasting, 10, 20, 30 plus years. However, life doesn't stop. Age will continue to happen, but you will be in a more youthful position so that these results will continue to age with you naturally and last as long as you would like them to.